It's one of the most natural bodily functions we have, yet many of us rarely give it a second thought until something feels off. I'm talking about urination. How often you visit the restroom is a personal rhythm, unique to your body, unique to your habits, unique to your health. But have you ever stopped to wonder, am I peeing too much? Or is this normal? It's a question I hear frequently from my patients. Understanding your body's patterns is a powerful tool. Your urinary habits can be a direct reflection of your hydration levels, your diet, and even a window into your overall wellness, sometimes signaling that it's time to check in with a doctor. Think of your bladder as a diligent, hard-working reservoir. Its job is to store urine. Urine is the waste filtered from your blood by your kidneys, the kidneys, bladder, and ureters. When it reaches a certain level of fullness, it sends a signal to your brain, letting you know it's time to find a restroom. This communication system is incredibly sophisticated, but it can be influenced by many factors. How much fluid you consume, the types of beverages you choose, certain medications, and underlying health conditions can all change the frequency of these signals. Paying attention to this rhythm isn't about becoming obsessive. It's about establishing a baseline so you can notice when a significant change occurs. One of the first questions people ask is, what's the magic number? While there isn't a single number that applies to every single person, experts have established a general guideline for what's normal. For most adults under 60, urinating between 6 and 8 times in 24 hours is typical. This assumes you're drinking a standard amount of fluid, roughly 2 liters a day or about half a gallon. The number can fluctuate day to day based on activities and what you consume, but it's a reliable benchmark. This range is mainly for waking hours. What about night? Waking to urinate, nocturia, can be normal, especially with age. For younger and middle-aged adults, getting up 0 to 1 time per night is usually fine. Getting up 2 or more times nightly may disrupt sleep and is worth discussing with a doctor. Consider bladder capacity. The average adult bladder holds about 1.5 to 2 cups, or roughly 350 to 475 milliliters. Ultimately, what's normal for you matters most. If you've always gone about 8 times a day and feel fine, that's your baseline. If your pattern jumps from 5 times to 10 times a day without cause, that's a big shift. It might sound obvious, but it's the most fundamental rule of bladder health. What goes in must come out. The single biggest factor influencing how often you urinate is your fluid intake. If you make a concerted effort to drink more water throughout the day, you can naturally expect to visit the restroom more often. This is a good thing. It means your kidneys are working efficiently to filter waste and your body is well hydrated. Conversely, if you are dehydrated, your body will conserve water, leading to less frequent urination and darker, more concentrated urine. However, not all drinks are created equal when it comes to their effect on your bladder. The most common culprit in our daily lives is caffeine. Your morning coffee, afternoon tea, that soda you have with lunch all contain caffeine, which can irritate the bladder lining and increase the frequency and urgency of urination. Alcohol is another powerful diuretic. It suppresses a hormone called vasopressin, which normally tells your kidneys to reabsorb water. This is why a night out drinking often involves multiple trips to the restroom and can leave you feeling dehydrated the next morning. If you feel your urination is excessive, try keeping a simple diary for a few days. Note what you drink, how much you drink, and how often you need to go to the bathroom. Sometimes, simple swaps, like switching to decaf coffee, can provide significant relief and restore your bladder to a more manageable rhythm. While it's reassuring to know that many factors can cause harmless changes in urination, it is equally important to recognize when your body might be sending you a warning sign. Medical professionals have identified certain red flags related to urinary frequency that should prompt you to seek advice. One of the clearest indicators is a significant deviation from your personal norm. If you typically urinate about 7 times a day and suddenly find yourself needing to go more than 9 times or 10 times without a clear reason, like drinking more fluid, it's worth paying attention. On the flip side, urinating too infrequently can also be a sign of trouble. If you find you are consistently going fewer than 6 times a day, especially if you are drinking an adequate amount of fluids, it could indicate a problem. This might suggest you are severely dehydrated, or in rarer cases, it could point to a blockage or an issue with your kidney function. Your body needs to expel waste products regularly, and holding urine for excessively long periods can stretch the bladder and increase the risk of infections. The nature of the change also matters. A gradual increase in frequency over many years is often a normal part of aging. However, A sudden and dramatic shift that occurs over a few days or weeks is more concerning. For example, if you go from waking up once a night to suddenly waking up 4 times a night, this abrupt change needs to be investigated. Finally, consider the full picture. When frequent urination becomes a noticeable issue, it's natural to wonder about the cause. One of the most common culprits, especially for women, is a urinary tract infection, or UTI. This happens when bacteria enter the urinary tract and cause an infection, most often in the bladder. This infection irritates the bladder lining, creating a persistent feeling that you need to urinate, even if your bladder is nearly empty. Another major medical condition strongly associated with frequent urination is diabetes, both type 1 and type 2. When you have uncontrolled diabetes, excess sugar, glucose, builds up in your blood. Your kidneys are forced to work overtime to filter and absorb this excess sugar. If they can't keep up, the extra sugar is excreted into your urine, dragging fluids from your tissues along with it. As we get older, other conditions can arise. In men, an enlarged prostate, a condition known as benign prostatic hyperplasia, or BPH, is a very common cause of urinary changes. The prostate gland surrounds the urethra, the tube that carries urine out of the body. As the prostate enlarges, it can press on the urethra, partially blocking the flow of urine. This can make it difficult to fully empty the bladder, leading to more frequent trips to the restroom. While much rarer, it's important to mention that frequent urination can, in some cases, be a symptom of bladder cancer. When a tumor grows on the bladder wall, it can irritate the bladder and reduce its capacity to hold urine, leading to increased frequency and urgency. This is often, but not always, accompanied by blood in the urine. It's a less common cause, but it underscores why a persistent, unexplained change in urinary habits should never be ignored. Your doctor can perform tests to rule out serious conditions and provide peace of mind or a path toward necessary treatment. Your body has a way of telling you when something is wrong, and it's crucial to listen to these signals. When it comes to your urinary health, frequency is just one piece of the puzzle. If your increased need to urinate is accompanied by pain or a burning sensation, this is a classic sign of an infection. Warning symptoms: burning, blood, sudden urge. Another alarming symptom that must never be ignored is seeing blood in your urine, a condition called hematuria. The urine might look pink, red, or cola-colored. Sometimes the amount of blood is so small it can only be detected with a microscope during a urine test. But if you can see it with your own eyes, it is a definitive reason to see a doctor immediately. The feeling of urgency is another important clue. There's a difference between gradually feeling the need to go and being struck by a sudden, overwhelming, and difficult-to-control urge to urinate. This is known as urinary urgency, and it can be a symptom of an overactive bladder, where the bladder muscles contract involuntarily. When this urgency leads to unintentional leakage of urine, it's called urge incontinence. Finally, pay attention to what happens when you actually try to urinate. Are you having trouble starting the stream? Is the stream weak? Or does it stop and start? Do you feel like you can't completely empty your bladder even after you've finished? This sensation of incomplete emptying can be a sign of a blockage, such as an enlarged prostate in men. These symptoms, combined with frequency, create a clear picture for your doctor. Just as our hair turns gray and our skin develops wrinkles, our urinary system also undergoes changes as we age. It's a natural and expected part of life. For many older adults, this means visiting the restroom more frequently than they did in their younger years, and this is not necessarily a sign of disease. One of the main reasons for this is that the muscles of the bladder can lose some of their strength and elasticity over time. A less elastic bladder cannot hold as much urine as it used to, which means it fills up faster and signals the need to urinate more often. Hormonal changes also play a significant role, particularly for women. After menopause, the decline in estrogen levels can lead to thinning of the tissues in the urethra and bladder. This can weaken the structures that help control urination and contribute to both frequency and urgency. Understanding that these changes are linked to a major life transition can be reassuring and helps women know that they are not alone. For men, the most common age-related change affecting urination is the enlargement of the prostate gland, or benign prostatic hyperplasia. The prostate begins to grow in most men during middle age and continues as they get older. Because it wraps around the urethra, even a small amount of growth can start to interfere with urine flow. This can cause a weak stream, difficulty starting urination, a feeling that the bladder isn't empty. The cumulative effect of these age-related factors means that the normal range for urination tends to shift for older adults. while 6 to 8 times a day is standard for a younger person. It's not unusual for someone over 60 to urinate up to 10 times during the day. Similarly, waking up twice at night may be considered within the normal spectrum for this age group. The key is to differentiate between the gradual expected changes of aging and sudden, severe symptoms. While it's wise to be aware of red flags, it's just as important to recognize the many situations where frequent urination is completely harmless and temporary. For example, simply being cold can make you need to pee more often. This phenomenon, known as cold diuresis, your body constricts blood vessels in your extremities to conserve heat for your core. That raises blood pressure, so the kidneys filter out excess fluid, filling the bladder. Hormonal fluctuations at different life stages outside of menopause can also be a factor. Many women notice more urinary frequency in the days before their period. During pregnancy, frequent urination is an early and common symptom. Emotional state can play a role. Needing to pee before a big presentation, a job interview, or another nerve-wracking event is common. It's a response to anxiety and stress. Fight or flight activation can stimulate bladder muscles and create an urgent need. Finally, short-term dietary changes can increase trips to the bathroom. Eating a large watermelon on a hot day or a soup-heavy few days adds extra fluid from food. Your body processes that water just like drinking it. Spicy foods, citrus fruits, artificial sweeteners can all irritate the bladder for some people and temporarily increase frequency. Recognizing these simple cause and effect connections can bring peace of mind. Understanding when changes are temporary and harmless helps you focus on what truly matters for your health. Now that you're armed with information, you can create a simple, proactive plan for your bladder health. The most important piece of advice is to know when to see a doctor. You don't need to rush to a clinic for every small change, but make an appointment for a sudden, persistent increase in urination without an obvious cause. Major red flags, pain or burning, blood in your urine, trouble starting or stopping your stream, schedule a visit right away. For day-to-day bladder wellness, focus on smart hydration. Drink plenty of water during the day, taper fluids 2 to 3 hours before bedtime to reduce nighttime wakes. Pay attention to bladder irritants like caffeine, alcohol, acidic, or spicy foods. You may not need to eliminate them entirely, but moderating your intake can often provide significant relief. Keeping your bowels regular is also important, as constipation can put pressure on the bladder and worsen urinary symptoms. A diet rich in fiber can help. Strengthening your pelvic floor muscles can make a world of difference, especially for issues with urgency and leakage. Pelvic floor exercises, commonly known as Kegels, are simple to do and can be performed discreetly anytime, anywhere. If you're unsure how to do them correctly, a doctor or a physical therapist specializing in pelvic health can guide you. Ultimately, the goal is to be in tune with your body without being consumed by worry. Your urinary habits are a valuable health indicator, but they are also highly variable. Reassure yourself that fluctuations are normal, especially with changes in diet, activity, and age. For adults over 60, urinating up to 10 times a day can be a new normal. By understanding the basics of bladder function, recognizing true warning signs, and adopting a